Hi, I'm Sarah. I'm a prescribing support dietitian and I work in the west of Northern Ireland, assessing patients from GP practices in clinics, in care homes and in their own homes. My job involves speaking to patients about their health, their appetite, their intake and any barriers they may have to being able to getting all the food they need for their health. Usually the patients I see have experienced an issue with low appetite or food intake and are at risk of malnutrition or are already malnourished. I work with my patients to make a suitable plan to enable them to get better nutrition. This might include eating small frequent meals, having more nutritionally dense foods and sometimes having prescription foods or drinks. I also help the patient manage any symptoms of any other health conditions they might have, such as respiratory problems, diabetes, cancer or bowel disease. I also liaise with other health professionals such as GPs, pharmacists, district nurses and care home staff to implement any nutritional care plans made for patients and to provide training on the management of malnutrition outside of hospital. Nutrition is a vital part of an individual's health, so working as part of a team with the GP, pharmacists and care home staff to inform them of what the patient needs nutritionally is fundamental. To work as a prescribing support dietitian, you need to have a wide knowledge of medical conditions affecting the nutritional needs of the body, as we never know what patients we will get. You need to have excellent people skills to communicate effectively with your team members, other health professionals and patients, including the ability to support people to make changes to what they eat, which can be a challenging behaviour to change, even when patients are very motivated. Organisational skills are very important. We have to balance seeing patients and managing clinics, documentation and communication, with meeting training needs for other health professionals, supervising student dietitians, professional development to keep our knowledge and skills up to date, and driving forward projects to improve the way we do our jobs. I wanted to become a dietitian primarily because I enjoy helping people, and as a prescribing support dietitian, I get to aim to improve quality of life for my patients by improving their health through foods they enjoy. I didn't realise that I wanted to be a dietitian when I started university, so I completed an undergraduate degree in evolutionary anthropology at the University of Liverpool. In my second year, I looked into careers in healthcare and loved the sound of being a dietitian, so I went to shadow some dietitians in the Royal Liverpool Hospital, and I knew straight away that I wanted to do that. So after my undergraduate degree, I completed a postgraduate diploma in public health nutrition at the University of Chester, then the vocational master's course Nutrition and Dietetics, also at the University of Chester. Completing the master's course includes clinical placements with working dietitians, and once you graduate you are eligible to register with the Health and Care Professions Council, who regulate dietetics as a profession, and after that you can be a practicing dietitian. Only people who have completed accredited higher education courses can call themselves dietitians. The name is a protected title. I love working with the Prescribing Support Dietetic team. We are a medium-sized team who work very closely together. We have to have high levels of cooperation. Everyone works so hard to improve the care of our patients. The role is also so varied that it's never boring. I see all kinds of patients and it is great to be able to improve patients' lives on an individual basis, but also by training other health professionals on the management of malnutrition and the appropriate use of prescription oral nutritional supplements, help them to help others and ensure the best use of our NHS resources.